Toenail removal. Introduction. The toenail protects the tissue of the toe. Select true or false. Correct. Toenails are made of hard keratin that helps protect the toe. Some or all of a toenail may be removed because of. Choose one of the following options. 1. Repeated inflammation of the nail fold. 2. Infection or tumor. 3. Fungal infection. 4. All of the above. Correct. Surgery may not be needed to prevent or treat toenail problems. Select true or false. Correct. Soaking, trimming, and using over-the-counter medicines are some treatments that can be done at home. A healthcare provider will want to know the details about a toenail condition before going forward with surgery. Select true or false. Correct. Details about your toenail condition can help your healthcare provider determine if surgery is the best choice to treat the problem. Your toe will be numb during the procedure. Select true or false. Correct. Regional anesthesia is used to numb the toe area. John had his toenail removed last week. Today his toe is painful. He also noticed that it is bleeding through the bandage quickly. Should John contact his healthcare provider? Select yes or no. Correct. Pain and bleeding may be signs of a problem. John should contact his healthcare provider right away. Antibiotic ointment needs to be applied to a toe regularly for the first few weeks after toenail removal. Select true or false. Correct. Antibiotic ointment and clean, dry bandages can prevent infections and further damage to the toe. Thank you for using Explain.